about 47 million Americans who are currently uninsured. That can go up or down depending on how you count, but that's about 1 out of 6 Americans who do not have insurance, and that's a lot of people, as we'll talk about, that would surprise you who don't have insurance. Since the recession began, an estimated 4 million additional Americans have lost their health insurance. 10,680 workers. These are people who are not sitting around or just goofing off. These are working families. 10,000 working families a day are losing their health insurance in the recession. We spent about $2.2 trillion a year since 2007. There's an interesting relationship between our national expenditures and those in other countries. Healthcare costs have doubled from 1996 to 2006. Healthcare costs have doubled since 1996. That is an extraordinary statistic, at least to me, and we'll see what that's doing in a minute to the national economy. In 2007, 60% of all U.S. bankruptcies were caused, at least in part, by medical unpaid bills. 60% of bankruptcies. So I think these facts are of some interest in the discussion as to why at least some of us believe that the status quo is not good enough for America, and we can't do better. Peaks of 35% for those in their early 20s. In middle age 35 or 45, it gets between 15 and 20%. It decreases dramatically because we have the benefit of Medicare that does keep our senior citizens. Who are the uninsured? This is a very interesting graph to me, one I really only saw recently. Pipe are not working. The reason I put this graph up there is it's interesting because I think it is different than perhaps a common perception as to who the uninsured are. Next graph, please. This is a chart showing our national expenditures per person on health care. The national average, the international average of the industrialized world, people who have economies somewhat similar to ours, is about $2,800. You see Australia 29, Austria 34, Belgium 33, Canada 25, Denmark 36. The United States is over at $6,567, about twice the national average of industrialized nations. And it's just an interesting chart. Draw whatever conclusions you want. Our life expectancies is not the absolute tops. We're actually number 35 nationally behind Bosnia and Jordan, life expectancy. So I think those are interesting. Draw whatever conclusions you want, but there is a significant difference in our cost structure between us and the rest of the industrialized world. Next chart. Here is an important chart, at least for members of Congress, because we know what a terrible fiscal condition the United States is in. We know how terrible the deficit is. We know the damage it can do for our long-term economy. We know that the recession has deepened the deficit because our revenues have gone down dramatically. So the question becomes, what will happen to the U.S. economy if the status quo continues, if we decide to do nothing and reject health care reform? Well, here's what will happen. This is a chart that shows the percentage of our national economy that goes to health care costs. In 1980, it was about 8%. It's doubled to 16% by 2008. So just in the last 28 years, it has doubled to 16%. And here's what is disturbing. Because of the aging population and because of the medical inflation rate, which today is 3 times the rate of wage growth. You want to know where your wages have gone? They've gone to healthcare inflation and insurance care premiums. By 2040, there will be 35 to 36% of the entire United States economy. It is a very starkly rising curve that will choke out our ability to educate our children, our ability to balance our budget, our ability to finance our Navy and our Air Force. It is my belief when people say we can't afford health care reform, my belief is we cannot afford to do nothing. Proposals of how to finance in the short term some of the investments in healthcare. And this is the House bill. By the way, let me back up. Let me tell you the status of the discussion in Congress right now. Neither chamber passed the bill. There are 6 committees in the House and Senate, 3 in the Senate, 3 in the House, that are dealing with this. 5 of those committees have passed bills. 1 has not, the Senate Finance Committee. In the House, the bill I'm going to describe in a moment here is sort of the House provision of how the Commerce Committee, the Ways and Means Committee that I serve in, I serve on the Energy and Commerce Committee. We have one of the jurisdictions of this. This is how we have proposed to pay for this so that it doesn't add significantly to the budget, to the deficit. First off, about 45% of it, these 4 slices of the pie, would be by finding and eliminating waste, fraud, and abuse in our healthcare system today, principally through Medicare, through some of the things that I'll show you in a minute that need to change. And 56% of it would be through a relatively small surcharge on Americans who are in the top 1% of income brackets.